What is fibromyalgia? Quite a difficult word to say, but all of the complex chronic illnesses don't tend to have an easy off the tongue name. But essentially, fibromyalgia is a disorder characterized by widespread musculoskeletal pain, accompanied generally by fatigue, sleep challenges, and mood challenges related to your symptom profile. So generally, this is widespread muscle-based pain and tenderness, which means that you can have aches and pains and touch sensitivity and those kind of factors to it as well. So everyone's pain profile is slightly different based on their experience and based on their diagnosis and their comorbidities, but generally it is chronic ongoing pain that the individual experiences probably almost all day, every day, but the pain severity fluctuates. So a lot of people think that a chronic pain syndrome means that you have pain and that's about it. But essentially you will have chronic widespread pain all day, every day, and the severity of that will change. So some people will experience pain on average sitting at 4 or 5 out of 10, 24/7, and it can escalate to 8 or 9 out of 10 quite regularly as well. So it's not as simple as it sounds. It will be pain symptoms. It will be other symptoms associated with that. And basically an individual with fibromyalgia will look completely fine, but they will be experiencing pain and presence of pain all of the time. And they generally won't communicate that, and you generally won't observe how often they are in significant pain. So fibromyalgia can also be called just a chronic pain syndrome. Other terminology can be central sensitization syndrome, and it kind of really depends on the person doing the diagnosis and also the symptom profile of the person too. So generally this is something that is diagnosed by a rheumatologist. It's important that they rule out all of the other things that can be associated with chronic pain and then help you understand what sort of interventions would be appropriate to help with pain management. Okay. So fibromyalgia is quite common. It is an invisible illness, meaning that you can't see it, which means a lot of people don't understand the significance of it because people look completely fine. But it is really important to understand that fibromyalgia is a chronic condition, and it is extremely challenging, extremely debilitating, and the person is in pain all of the time. So it's really important to recognize that, we understand that when we stub our toe and we go, ow, that really, really hurt, we understand that pain is a really uncomfortable sensation. For most people, pain is acute and temporary. For those with chronic pain, it's not. It's actually there a lot of the time, and I cannot specify that any further. I know I've repeated myself, but it's really important to understand that people with fibromyalgia don't have respite away from their pain. And just because they present okay, doesn't mean that they're not dealing with 5 or even 10 or 15 or 20 symptoms internally within their body that require micromanagement to support them in just being able to experience their day. Okay, so there are treatment supports for something like fibromyalgia, and this will be everything from pacing and understanding triggers and trigger management. This will also be things such as medication intervention, depending on the diagnosis and the rheumatologist, etc., and many variations within all of those examples. But it will be dependent and different from the person, their predisposing factors, their precipitating factors, their comorbidities, as to what treatment or management profile will be for them. Okay. So fibromyalgia, the prevalence is higher in women than it is men, and it can be diagnosed at any age. And generally it is a process of elimination to rule out everything else. And then the diagnosis of fibromyalgia will be from there. Okay. So it's important to understand that there is still a little bit unknown about this condition, and it's not just as easy as here's your diagnosis. Okay. Now, one thing is that those that experience hypermobility throughout their life, so if you were someone who was a little bit extra bendy and flexible early on, you might have a hypermobility spectrum disorder, which may be a predisposing factor to experiencing fibromyalgia, or may actually be your diagnosis instead of fibromyalgia. So we do understand that there are certain predisposing traits that will lead to us being more likely to develop something like fibromyalgia, which will influence our symptom profile. So for those who have a hypermobility spectrum disorder history or hypermobility history, then they may have more joint pain alongside their musculoskeletal pain, or they may have a different pain profile. So it's very important to explore what symptoms it is that you're experiencing, and therefore your health team to help you understand what strategies will go a long way in supporting you in managing those. Okay. So if you have any questions, please comment below. If this is something that you feel you are experiencing, please look into it further. Please speak to your health professional so that you have answers to understand your journey and your story, so that you can begin to take control of your circumstances in whatever way may be manageable and accessible for you. So I hope this helps, and see you soon.